Okay, folks, I want to welcome you back to the live cancer show. It's sometime before 4th of July. Don't ask me when. It's after Father's Day. Hope you had a good weekend. We had a fantastic one. And I'm really excited about tonight who you're going to get to meet, Beverly McKee. You know, I got the best job in the whole world because I get to meet a lot of neat people every week. And Beverly and I ran into each other online a few weeks ago, and we've been talking the last hour or so, 30 minutes or 40 minutes, however long. But folks, she has gone through cancer. I want her to tell you her story. But then she's got some tremendous programs that will just knock your socks off on how to help you get well and some things as a cancer survivor, where to go. And I think you're going to have a good time tonight. So I want you to welcome Beverly McKee. And hi, Beverly.
Hi, Dr. Hall. How are you tonight?
You know, good. First thing off, my wife won't call me doctor. My kids won't call me doctor. So I figure nobody else has to. And if I can't call you doctor, then let's drop that crap, please.
All right, Roy. Well, it's great to be here tonight. Thanks for having me.
Say, I want you to tell me kind of how you fell into this world, or what you're doing, your diagnosis of cancer, and what all happened with you.
Well, I was diagnosed with stage 3 breast cancer. I was fairly young at the age of 42, and it was quite shocking, as it is for everyone. I had had a grandmother who had had breast cancer about 40 years ago. She didn't tell anyone until it was too late to get treatment, and by the time she was diagnosed, it was really too late for anything to be effective for her. So I'd always had really great breast health. I was aware of everything I needed to do. I had been seeing an oncologist off and on throughout the years. But my type of breast cancer is a little less common than most people's. I have lobular carcinoma. Only about 10% of us get this kind, and I never had a lump, and it was never detected by a mammogram. So I had actually found a cyst on the other side. I went in for that, and my doctor said, oh, yeah, let's take a look at that cyst, and it was actually an ultrasound that detected my lobular carcinoma.
Okay. Now, you mentioned seeing an oncologist periodically. Nobody sees oncologists periodically unless they're married to one.
Well, I had found a lump when I was 29, and I went in and I had that biopsied. It was all fibrocystic changes. They told me it was all fine. And then I had also found a cyst in 2005. I had just finished breastfeeding my youngest son, and I had found a cyst at that point. And so my oncologist said, you know, let's continue to see you and keep up with the mammograms. I started mammograms at the age of 29. So mine was a little bit unique.
Okay.
But even with all of that, really taking care and breast health and all of that, we didn't find it till it was stage 3 because the mammogram didn't detect it.
Right. Yeah, they don't find the lobulars that way. So did you have an inkling of what was going on beforehand, or?
You know, I really, really didn't. I was very healthy. I had just ran my first 5K a few months before that. I'd always been very healthy, very active, but I had never run before. I had it on my bucket list. I ran my 5K, and 3 months later I was diagnosed. So it took me by surprise, absolutely.
Okay. And you're married with a husband and a couple of kids. How did they handle it?
Well, my husband was terrified, and he tried to be really strong and stoic, but he was very, very afraid. My little boys were 7 and 9 at the time, and quite honestly, I think that their ages were really good to have been diagnosed with breast cancer because they understood that I was going through chemo, I was going to have surgery, they couldn't jump on top of mom, they had to be careful around me, but they had no idea the true ramifications of breast cancer. As a matter of fact, I share a story, and just yesterday, my oldest son was talking to his friend, and if you ask my boys about my bilateral mastectomy, they will tell you it was the best time in their life because they got to have not 1, not 2, but 3 sleepovers with their friend on school nights. So for them, they really didn't understand the concept of how difficult breast cancer can be and really some of the ramifications that come with it.
Okay. I told you a while ago that I worked with Carl Simonton, and he often talked about the benefits of cancer, and a lot of people don't understand that. A few weeks ago we had the ladies who wrote the 100 Perks of Having Cancer, and I even had some people online get mad at me saying there's nothing beneficial about it. And as you just said, there are some benefits. It's not what you think, but there's little things. If you look for it, you can find that. So I applaud your kids for finding the benefits of having cancer. Did I just lose you? Oh my goodness. Everybody, I think I just lost our hostess or our guest tonight, Beverly. So why don't you look at me and let's see if she doesn't call back in. And here she is
Here
again.
I am. I have no idea what just happened.
Here today and gone tomorrow, huh?
That's right. I'm jumping all over. I did not hear your question.
You know, I was just saying when I worked with Carl, he talked about the benefits of having cancer, and there are benefits of it. And he talked about a guy who, um, I just went blank on where I was going with that one guy, but there are benefits. And a few weeks ago we had Florence Strange, and I just went blank on the other lady who wrote 100 Perks of Having Cancer, and a couple of people got mad at me online saying there's nothing beneficial about cancer. And there really are some benefits if you look for them. It's not the benefits you go after, but it sounds like your kids found some benefits. And
That's right. And what I chose to do is I looked for the rainbows to the storm of breast cancer. Breast cancer is not a fun thing to have. I would not wish it on anybody. I would never want it again, but I really feel like it did change my life for the better. And I have talked to women all over the world who use breast cancer as a catalyst. Once you have it, you you have it, and there's nothing you can do to unhave it anymore. So my approach was that I'm going to embrace it and move forward with it and change my life because of it. And I really have seen a lot of positive change because of that.
you know, in my 37 years as an oncologist, the people who get well and have a high quality life are doing just what you're doing. Cancer, it's not a game. It's a serious piece of business. People die from it, but they learn how to handle it and treat it like other people going through a bankruptcy or a divorce or heart failure, and they come out a little bit differently. And one of the things I've learned is the oncologist doesn't know how to get people through that transformation, and that's why, in my thinking, the chemotherapy and radiation therapy is not the secret bullet, but it's what people do at home and what people do like you do with other folks with cancer. So why don't you tell us about a little bit about that?
Well, I was about halfway through chemotherapy. I had been blogging for my family and friends on a private blog, and everybody kept telling me, wow, you should really share this. It's quite inspirational, and we find ourselves wanting to make positive changes in our lives, and we're not even dealing with cancer. So I started breastcancerwarrior.org, and I started a blog, the Breast Cancer Warrior blog, and I just started blogging about my journey. But every time I blogged, I would find something positive to share with people in my own journey. And we now have followers all over the world. We all get together and we support one another. I wanted a positive place where women could come together and support one another without the scary statistics, without everybody talking about the most negative or the scariest or the hardest parts necessarily, because there are scary parts and there are hard parts, and I had bad days. But we share support and positive energy with one another. So we have somebody maybe getting ready for their bilateral mastectomy, and they might be afraid, and they'll ask for some support, and women from all over the world come together to support that woman because they've been there and they've done it, and they know she's going to get through it and she's going to be okay. It's absolutely so powerful.
Wow, nice. Nice. You know, one of the things I've seen as an oncologist, particularly I want to say with breast cancer more than others, is the difficulty the husband has with the diagnosis. And then from my standpoint, it may not be right, but I'd see the couple come into the clinic, the lady with the cancer and the husband, and then here comes the oncologist asking all these questions and examining the wife, and the husband has been trained to be the protector of that lady, and now he's having to give things over to somebody he's never met before and probably doesn't even like being there. Question is, how do we get the husband more involved, or how do we support the husband, or what does that fella need?
Well, I know for my husband, he did not feel like he had a lot of control, and he couldn't really do a lot to help me other than just be there for me. And I know that was incredibly difficult for him. And I think that just acknowledging that is really important. And one of the things I told my husband early on, I told him he had to have somebody to talk to very honestly, very openly, and it couldn't be me. Because he wasn't going to come to me and say, I'm terrified you're going to die. I don't want to raise our boys by myself. So
Yeah.
he needed somebody he could talk to. And I know he leaned on his sister quite a bit. He leaned on his mom quite a bit. So I think one of the most important things is that a husband or the primary caregiver has somebody that they can lean on. And men typically are not wanting to talk to other people. They want to be strong and stoic. So I think it's important for them to find that person.
Oh, thanks. Yeah, I like that. So, what else is going on with the cancer warrior, breast cancer warrior org?
Well, one of the things that I started early on, and I'm really excited about the progress we've made, I was meeting with my oncologist early on, and she was talking about 5-year survival rates. So I was in her office. We were talking about all of my different options. You know, this many people, if they have a mastectomy, they'll have this survival rate at the 5-year mark, or this many people survive 5 years with a lumpectomy or radiation. This was very early on. I kept hearing 5 years, 5 years. And it dawned on me that my little boys wouldn't even be driving in 5 years. So I finally interrupted my oncologist, and I said, you know, Dr. O, with all due respect, I don't care about 5 years. What do I have to do to survive this for 40 years? And she patted my arm, she laughed out loud, and she said, okay, Beverly, let's plan aggressively. Well, I went home that night, and I started thinking about that conversation. And I thought, you know, I'm going to do something quite unexpected. I planned a party, and I set it for 40 years in the future. October 17th, 2052, on the beaches of Sanibel Island, Florida, and it is going to be the party of a lifetime. And I did that because I wanted something far out in the future that I could look forward to, and I could visualize those white tablecloths on the tables with candles blowing in that beautiful breeze coming in off the ocean. And once I set that party, I started looking for a book about long-term breast cancer survivors. I wanted to surround myself with role models. Who else has done it? What have they done differently? Do they have any suggestions for me? And there aren't any books out there. So I decided to write a book. And I just interviewed my 40th long-term breast cancer survivor about 2 weeks ago. I'm in the process of editing the book. These women have lived 20, 30, 40, almost 50 years past breast cancer. And it started out as writing a book to create hope, but these women have become my friends. They're my mentors. They're my role models. They're all my heroes, and I am just ecstatic about sharing this book with everybody.
How did you find these ladies? Were on your website or?
You know, I kind of found them all over. I met one woman when I was taking my mother-in-law to her oncology treatment. She's got breast cancer as well, which is crazy. She was diagnosed 3 weeks after my last PET scan. She was diagnosed with breast cancer, so I'm actually helping her through that now. I've met people on Twitter, social media, all types of social media. I connected with a woman in Australia, and she knew of a long-term breast cancer survivor that lived 3 counties away from me in the state of Missouri. People have told me if they were interviewed, they shared their friends with me. I've done some articles down in the Sanibel newspaper, and somebody who vacations down there read that. Her mom's a long-term breast cancer survivor. So they're from all over the world, and I've found them all different ways. It's been just a journey in and of itself. It's been amazing.
So when's this book coming out?
Well, it'll be out by fall. So I will be keeping everybody posted. You can check out my website, breastcancerwarrior.org, and you can join my email list there, and I'll keep you posted about the book.
While we're on that, tell us about your Facebook address too, please.
It is The Breast Cancer Warrior. So if you go to Facebook, facebook.com/The Breast Cancer Warrior, and I encourage anybody who's been touched by breast cancer in any way to come on there, take a look, and just enjoy the support that's on there. And we do fun things like Gratitude Monday, because I really am a firm believer in finding gratitude even in the dark days. But the most important thing I think that my breast cancer Facebook page shares is that you're not alone. And there's no right or wrong way to do breast cancer. We all do it in our own way, and I think that's so important for women to know.
Yeah. You know, I ask a lot of my patients, do you want to get well? And it's really interesting. some of them right off the bat says, yes, I want to get well, and others kind of think about it, and then others, the spouse will say, well, certainly he or she wants to get well. And then I ask them, why do you want to get well? And some of them say, because I got so much more to do, I got my kids, I got my work or whatever, and other people say, because I really don't want to die.
Mm.
And I like what you said about planning a party 40 years down the road, aiming for something positive rather than running from that black box. Because I think those people who have something they run towards that gives them hope do a lot better than those who either don't want to get well or running away from the grave. And I saw that on your website about the party in 2052, and I thought, must be a typo here. And then I was trying to figure out what you meant, and now you tell me 40 years down the road, I understand it. So, way to
Well,
go.
and you're invited. Anybody listening or anybody watching is invited as well. My husband keeps telling me to stop inviting people. It's going to be such a big party, but you know what? That's okay. It's going to be on a beach. There'll be room for everybody.
Well, I hope you have a thing for wheelchairs. I'll be 101 then. And
Well, my pledge to everybody, I'll be 82, but I promise to have wheelchair and walkers
friendly.
that will go on the beach, sand friendly. So no worries.
Okay. Perfect. Um, I'm thinking right now. With your oncologist, what was your role with her? It was a lady I saw, and you mentioned her name a while ago. Did you barter with her, argue with her, or how did you interact with her?
Well, I had three different oncologists. I had my surgical oncologist that I told I wanted to have the long-term, that party, or I wanted to survive 40 years. I told her about my party as well. I had a chemical oncologist, and then I also had my radiation oncologist. And they were all three very different. My surgical oncologist was a little more old school. And of course, what a lot of people don't realize is that every type of oncologist kind of has a different role. So my surgical oncologist wanted to cut that cancer out. So she and I agreed that we would be aggressive, and she really was very open with me. I educated myself as I went along. I asked a lot of questions, and she really appreciated that. And then my chemical oncologist used to be a nutritionist, which
Oh,
was pretty fascinating. So we talked about a lot of diet. I learned a lot of things that I didn't know before I was diagnosed. You don't know what you don't know. And so she really helped me learn a lot about diet. And then my radiation oncologist is also very into diet and more holistic information. So she was a great source of information. And along the way, I learned about acupuncture. We talked about that a little while ago. I encourage any woman who's struggling with that fatigue and the nausea from chemotherapy to consider acupuncture. Just try it once.
yeah.
If you don't like it, you never have to go back. But I was able to not take the steroids that they send home with you. I didn't like how they made me feel. I told my oncologist I don't like how they make me feel. I described it as they made my head feel buzzy,
Yeah.
and I just didn't like that buzzy feeling. So I did acupuncture in place of those steroids, and I was able to avoid taking those and still was able to get around the nausea, which was pretty fascinating.
Nice, nice. You know, I told you a while ago, we talked about it working with Carl Simonton. He taught me, he said, Roy, trust people to be who they are. You trust a thief to be a thief, and you trust a surgical oncologist to be a surgeon, and the medical oncologist to be a chemo person. And I think all of that's good. And I think, too, like you just said, you got to bring in other people who, the medical guy, oncologist, doesn't know a lot of nutrition as a whole. I sound like you lucked out with one who came from a nutrition world. And you
I
don't expect the surgical guy to understand chemotherapy, but you use them for what they're good for and then build your team according to what you need.
Absolutely, absolutely. And you know, the other thing that I think women underestimate, and we talk a lot about, is once treatment ends, it's really exciting. You know, you count down your radiation days. I had 28 radiation treatments, and I couldn't wait to get to the end of them. But then I walked out of that radiation room, and not only was I all alone, the doctors weren't looking at me every day, but I wasn't doing anything to actively fight the cancer other than I was taking tamoxifen. before I had a prophylactic hysterectomy. But I wasn't actively fighting that cancer, and it was scary. And I don't think a lot of women know that. So my message to women going through active treatment is, don't be surprised if when you get on the other side of treatment, there's this whole shift in how you think, and it can be frightening, but it's also very exciting if you embrace it.
How do you prepare for that?
I think
Do you,
the knowledge that it can happen, the knowledge that you're not alone, but I also think that that's where a lot of fear-based decisions are made. I know for me, I started really researching diet, but I took it to an extreme, and it was the only place that I had control. So I really was very, very stringent in anything that I would eat. And I found with time that leveled out. And I kind of knew that. I even told my husband, I'm a little freaked out about this right now, but just hang in there with me. I'll get through it. It's kind of a phase. But this is where I feel like I have control. And one of the most amazing healing questions that a good friend of mine asked me, she's a fellow survivor, she's a breast cancer advocate, she does a lot in the breast cancer community. She asked me a simple question. Beverly, what are you doing to survive versus what are you doing not to die versus what are you doing to live? And it was such an interesting question, and I was able to say, okay, I want to be healthy. I want to have an active lifestyle. I don't want to be afraid of dying anymore. And it was really instrumental in my healing process.
wow. Now, as a therapist, how do you tell people to deal with the fear of the cancer, the fear of dying or the fear of the unknown?
The fear is tough. It really is. And if we can just acknowledge that it's really tough, I think that will help. And we all have it. You're not alone in that fear. And I encourage you to find a support system. For some people, it might be a support group through your hospital. For other people, you might want to just connect with somebody either in the chemo room or maybe a friend who's gone through breast cancer. I had a friend of mine that I've known since kindergarten. She was diagnosed a month before me. So we went through everything together. It was really heartbreaking on one hand, but it was so amazingly supportive on the other hand. Or you can go to an oncology, a therapeutic oncologist, somebody who specializes, a therapist who specializes in oncology. And any kind of those support systems will help you work through that fear. But I encourage you meditation can help, blogging about it or journaling about it, and really just talking to somebody about it really helps.
Okay. Easy ways to find a good therapist if you want one. Shouldn't say you need one because probably everybody needs one.
Well, most people can benefit from a little bit of therapy, there's no doubt. I would talk to your oncologist, quite honestly, and ask them if they can recommend somebody who specializes in dealing with oncology patients, because it is a little bit of a unique need because you're dealing with some things that maybe some therapists wouldn't necessarily be well versed in. So I would recommend talking to your oncologist first.
Okay. Could I throw out maybe talking to your oncology nurse?
You know, those oncology nurses, those chemo nurses, that's actually a really good point. They are so amazingly helpful. And if you are blessed like me to get a good one, I had not one good oncology nurse, but I had 4 good oncology nurses. And they see the patients every time they come in for those chemo treatments. And sometimes they're a better predictor of what's going to happen even than the oncologist. No offense to all those wonderful oncologists out there, but those oncology nurses are really pretty amazing. So they might be a good person to ask to, and then really just ask around.
Okay. Yeah, I agree I think, it's a generalization. A lot of us oncologists know the chemotherapy and that aspect, but we really not very good at the soft stuff and the nursing personnel. In my clinic, the nurses ran the clinic. They told me what to do, when to do it, and when to sit down and when to go to lunch. Yeah, the best oncology clinic is run by the nurses, and those people tend to know what the other patients are doing, whereas the oncologist may not know quite that often.
Right. And those support groups too. Those support groups can probably recommend a therapist as well.
Now, something really fun. I saw on your website a cruise. Tell me about that.
My goodness. One of the women I interviewed for my book is a long-term survivor. and she's actually a co-host of a breast cancer thrivers cruise. And I interviewed this woman for about 2 hours. We just really hit it off when I was interviewing her about her survivor story. And she told me about the cruise, and I hung up the phone with her, and I ran down to my husband's home office, and I said, honey, I'm going on a cruise with a bunch of breast cancer survivors. And he said, okay. Well, I have to just tell you, and I just wrote a long blog about it. It was so much fun, first of all, to get away from all the responsibilities of anything related to breast cancer in terms of just the stuff that you have to deal with on a daily basis. It was nice to get away from, I love my family dearly, but I got away from my family. I took a break from all of those responsibilities, all my work responsibilities. I boarded a ship. There were 200 of us total. Most of them were breast cancer survivors. Some of them were co-survivors, best friends who had helped their friends get through it. But we all sat at these tables together for dinner every night. I met women from all over the world, and we started out talking about, when were you diagnosed? What stage were you? What kind of chemo did you have? And then it kind of broadened to, well, what's your life like after breast cancer? And eventually we started talking about all of our life instead of just that one small piece, the breast cancer piece. And we all formed friendships that will last forever. We went to Belize. In Belize, I went ziplining. I was less than a year out of chemo. I was about a year out of chemo, and I was ziplining. I was in radiation a year before that. And I went swimming with dolphins. That was always on my bucket list, so I went swimming with dolphins. My roommate was a woman from Australia who's a survivor, and we just hit it off. We'll be forever friends. It was just absolutely so healing for me. So I highly recommend it, and I'm actually forming a group of breast cancer warriors to go on the cruise next year. So if you're interested, just check out my website. It'll be on there.
Were there any men on this trip?
There were 4 husbands. I came home and I told my husband I promised to never ask him to go with me on the cruise. Because the husbands were good sports, but it really was all about the women on the group and just their survival and thriving afterwards.
Yeah. Oh, I bet that was good. Oh.
It was amazing. And one thing I do recommend to women is it doesn't have to be an extravagant cruise, but I always recommend that you plan something on the other side of treatment. So when you know that you're going to be done with radiation or chemotherapy or whatever your journey is, plan something that you can look forward to. Whether maybe it can be a vacation or a trip to see somebody or even just a special night out with friends, but having that to look forward to in your dark days and be able to focus on that really is very helpful.
Nice. Really nice. Wow. Anything else we need to cover? We're running out of time.
This has been a quick half hour.
I know. It goes by fast. Why don't you tell us again your website and your Facebook name?
My Facebook is facebook.com, and then it's The Breast Cancer Warrior, THE, and my website is breastcancerwarrior.org.
Okay. What I'll do after the show tonight or in the morning, I'll put all that stuff in writing somewhere up on the screen so folks, when they see that, can find your site very easily. And yeah.
That
Anything else you want to tell us? Oh, your book title, do you know that yet? Or?
You know, it's so funny. It's the hardest part for me is the title. I have about 3 titles that I'm down to, so I should have a name for it in the next couple of weeks. That's so funny you asked, because it is. I want it to be sensational, but an easy to understand title, so I'm working on that still.
Harder than naming one of your children?
Maybe. Actually, I think it is. I think it's been harder than naming my children. That's pretty funny.
You know, I offer a lot of my patients my name. In fact, I tried to franchise it because there's not many Roys out there. And so for $50, you can have an exclusive on this, and if it's a girl, you can name it Royetta. Nobody's taken me up on that.
Oh, that's funny.
Okay. Well, let me sign off. And any last thing you want to say, Beverly?
I want to say thanks for having me, and just to reassure anybody out there going through breast cancer that if you look for the rainbows through that storm, they are there waiting for you to find them.
You know, you're really magic. You're magic to what I'm hearing, and then I can't say what I want to say because it's too big, but thank you anyway, and thanks for your work. And let me sign off here, then we can finish off offline in just a second. So Everybody, you need to go to Beverly's site. It's the breastcancerwarrior.org. Go to her Facebook site. Find out, sign up for newsletters, sign up for that cruise. She's doing some magic things. She knows how to get through this, and she can help you get through this. And we can all do it together. So I want to thank you for watching tonight. And there's not a show next week or the next 2 weeks because I'm traveling on my motorcycle, but we'll get back together in July for some other great shows. So look forward to meeting with you. And this will be up on YouTube tomorrow if you want to download it and look at it again or whatever, folks. So enjoy and have a good night. Thank you.